Welcome, and thank you for choosing to apply to our new family medicine residency program at Upstate Medical University. My name is Dr. Gene Bailey, and I am the program director for our program. Before I start, it is during these unprecedented and challenging times that I pray you and your families are staying safe and well. It is important to keep with the recommendations of social distancing, wearing a mask when appropriate, and washing your hands. So I am very excited and energized about this opportunity to offer a very diverse and in many ways different family medicine residency program in Syracuse, New York. My personal statement on the website summarizes my personal desire for the program, but also please feel free to explore the other information provided in each one of the links. Due to all interviews this year being virtual, we have included some videos to give you a look at the excellent facilities and experience we have to offer. If you click on the faculty link, you will see that we have assembled a very passionate, experienced, caring, and talented faculty that come from around the world, literally. They are also very excited and ready to innovate and trailblaze this program. And as residents in this program, we are looking to you for your creativity, innovation, and curiosity. You will be an integral part of our moving forward to and building the foundation of where we want to go as a program. During this presentation, our agenda is as outlined here. I will introduce you to our Upstate team that is composed of our faculty, residents, and staff. Our mission and vision for this program leads us and directs us as we move forward in building our future together. We will review the rotations during the PGY 1 year, and we can also look at the second and third year as well, where there are many selectives and electives for you. Our curriculum is based on the Society for Teachers in Family Medicine, or STFM, and our American Academy of Family Practice, or AAFP, guidelines, and recurs every 18 months. Residency life is critical to our success, not only for you as a resident, but also for your personal growth and resiliency for life to come. I have some slides on Syracuse, New York, and why I feel that Syracuse is a nice place to live and has become my home. And then lastly, I will present some slides that were given to me by faculty members in our department that will outline some of the opportunities available to you in our program. We have an amazing and dynamic, talented and committed faculty team. They are intimately engaged not only in educating our residents, but also at a personal level. We want our residents to be welcomed and to have access to us. For the past 2 years, residents have shared many experiences and also have worked among us to solve problems as they arise. Our faculty include expertise from many different areas of concentrations. We have a seasoned medical director from a large healthcare system in Pennsylvania, a family medicine doctor who is fellowship trained in cesarean section for maternity care, faculty who are board certified in integrative medicine, and we are especially proud of our psychiatrist who works with our residents from day one. For Ballant Group that occurs 1 time per month, for every resident, we are happy to have a very experienced clinical psychologist working together with us. As we are connected to the VA hospital, we are fortunate to have a faculty member who directs the Women's Health Clinic and also spearheading a lot of research there. She has also recently been awarded a HRSA grant to begin a rural training track 1+2 with our residency program. Our chair, which is in the upper right of this slide, is very supportive and equally invested in the success of our residency and works tirelessly at the institutional level to advocate for family medicine and primary care. Of course, the most important person is the person on the lower right hand of this slide, and it's usually the one that's working behind the scenes, keeping us going and on track. Without our program administrator, Heather O'Hearn, we would often be aimlessly lost. You may have already been contacted by her, but please feel free to contact her with any questions. I am also available via email if you have any concerns or questions regarding the program. And I put my email on the introductory slide during the welcome. I cannot say enough about our trailblazing residents. They are the backbone of our program and really the reason we all do what we love to do. This program is about them. It's about you. Together, they have been leading the charge in helping us to build, grow, and implement the components of this program. It can be challenging at times, especially given COVID, but they have always stepped up to the plate and I believe are hitting it out of the ballpark. We are excited to now have a full complement of residents with this year's entering PGY1 class. And what can I say about our staff? You will be working in the continuity clinic with dedicated nurses and other staff that put patient care first. They love our residents and look for ways to help and make their lives better. They are first in line for clinical issues or concerns and will become one of your best friends in our clinic family. So what is our mission for the residency program? And I just want to read what it is that's on our website, and I just basically translated to this slide. We want to prepare exceptional family physicians providing exemplary patient care. We want to foster scholarly activities and research. We want to inspire leadership, and then we want to advocate for policies that support community health and holistic approaches to healthcare and prevention. So how do we accomplish this? There are multiple aims for our residency program, but most importantly, we are a community and university-based program that has integrated two strong academic institutions that are home to many residents and faculty and educational opportunities. And we combine that with a community hospital that is the home to this residency program. We call our program new. However, we also think of it as an older program, basically because we are so connected to Upstate Medical University and they have been in the educational business, so to speak, for over 50 years. We also have created a direct link in the bottom left hand of this slide, a direct link to the Department of Public Health and Preventive Medicine through SUNY Upstate for a formal educational opportunity to be offered to you that's called the Certificate of Advanced Study in Public Health, or CASPA. The department also is engaged with the community, directing the Onondaga Nation Clinic, which is in the lower right hand of the slide, and also a rural site. This is where the rural training track will begin in Auburn Community Hospital, and also opportunities through our rural medicine program that we encourage our residents to become involved with. We are not a cookie cutter program. We offer a wealth of experiences that tailor to your interests and or your areas of concentration. As residents in this program, we are looking also to you for your creativity, innovation, curiosity, leadership teaching. You will be an integral part of our moving forward to where we want to go as a program. So when I think about our program, there's two images that I want you to think about, and that's number one is the eagle. The eagle, when I see this picture, speaks to me about aspiration and innovation and elevation and grace. It's the pinnacle of flight. It's the pinnacle, it represents the pinnacle of birds. This is where I see our program rising to. Now, when we take this, I mean, first of all, fortune favors the bold. Flying high and majestic and aiming high is something that we want to do in our program. Now, as we come down to the ground level, this is the picture that I want you to think about for our residency program. Obviously, you see a very luxurious building here. And right now, obviously, we are forming the base and the foundation, but these turrets that you see, actually, I believe could be the areas of concentration that our residents will be building up each and individually for themselves. And then also, this will be a building that when future applicants and then soon to be residents come into, they will be just awe-inspired and want to check it out and see what's going on and see where their interests lie. We're always willing to build new turrets as well. So, you know, some grand visions for this program, but I really think that we are on our way to making this happen. I'd like to move on to the rotations. This is our rotation diagram. And I just want to point out at the top that that's your PGY 1 year, where you'll be building your family medicine foundation with core rotations in internal medicine and surgery and labor and delivery, GYN, ICU, and pediatrics. During pediatrics, there will be newborn, inpatient, and outpatient. Continuity clinics during the first year are 1/2 day, and they occur on Tuesday morning. And then we'll get into this later with didactics. During the afternoon, you'll have didactics on Tuesday as a first year. During inpatient medicine, we have formed a teaching service so that you'll be with a PGY 2 and 3 as supervisor. The team caps at around 12, of course, depending upon how busy they are. They also can go up to 16 if needed. During PGY 2 year, you'll do more subspecialties, increasing your breadth of knowledge and skills, and increase continuity clinic from 2 to 4 half days per week. And then during the PGY 3 year, you'll be learning about practice management, research skills, sports medicine, and whole health. Continuity clinic, again, is 2 to 4 half days per week. Note that you'll have 2 electives during the PGY 2 year and 3 electives during PGY 3 year. This is intended for you to pursue an area of concentration that will help to shape your future ambition. Okay. Oops. Okay, our curriculum begins actually at orientation. It's composed of topics from the STFM residency curriculum and the Family Medicine Residency Curriculum Guidelines from the AAFP. During orientation, you'll receive education not only from us, but also from Upstate Medical University that's aimed at all residents. And then specific topics will be presented for our own residents during orientation. This includes professionalism and wellness and communication, as well as others. For PGY 1 year, we have available our Tuesdays that are reserved for continuity clinic in the morning, and then the afternoon is devoted to didactics. We refer to this as Teaching Tuesdays. There is a combination of 1-hour didactic presentations from our upstate specialists, or block hands-on and discussion blocks regarding selected topics. For example, one of our faculty will speak on shoulder, knee, and ankle, and then residents can move to the anatomy lab where they review pertinent anatomy and also perform injections. Another example is an afternoon session on maternity, ultrasound, and then an opportunity to scan OB patients. This time is also for Journal Club, 1 time per month, with all the residents and other administrative time as needed for the program director and associate program directors. Why is this not working? So this is an example of our schedule for didactics. PGY1 is here. And what I've outlined in blue is really sort of at the end of the day, we always end with some wellness or journal club activities. And so you'll see that Balance Group is here. And then we have some whole health, some basic research and critical appraisal skills, and then wellness with motivational interviewing and exercise. So we always try to end with something like this. I've outlined in red here one of the examples of a block rotation where we discuss OB ultrasound and then have an opportunity for you to do hands-on with patients. Resident life is very important to our program, and it's one of the highlights, I believe, that makes us maybe a little different than others. We have limited 24-hour shifts, limited night float, so you have plenty of time to spend time outside of residency with your family or doing some activities that you feel are important to your work-life balance and wellness. You will have quarterly faculty advisement meetings, and it is the intent of those meetings to help guide you through the residency program. Also during those meetings, they'll be reviewing a lot of the feedback that comes from faculty on rotations, also your goals and aims, and then also getting you ready for your electives, reviewing your in-service training exams and those sorts of things. Your faculty advisor may become a mentor for you, but there's also plenty of other mentors at Upstate that you'll discuss with your faculty advisor if you just decide an area of concentration that may be outside of your faculty advisor's scope. We also provide for you study aids for your in-service training exam and step 3. The New England Journal of Medicine Knowledge Plus is really something that you'll have for 3 years and offers thousands of questions. And then we also pay for 3 months of UWorld for preparation for step 3. If you are present at any conferences, we will pay for your travel. Lunch is often provided at the didactic lectures. We really encourage social gatherings at least quarterly, and we are very invested and in our wellness curriculum and our Balance Monthly. This is something that our residents have told us that is a real highlight of the program. I have some pictures. So you can see here is where we have our residents in the anatomy lab. And one of our faculty is showing a joint injection of the knee. We had one of our residents who was able to join us. I'm a school physician for football, and this was even during PGY1 year. This is at during our orientation with some residents at the Everson Museum in Syracuse, and then just some other activities that residents are doing. Just again, some other pictures of things that we like to do with each other together. Obviously, we're in a COVID environment right now, so plenty of masks, some Halloween get-togethers, So there, and then we had a nice little gathering at one of our parks um, as well. So resident life is really, really important, and we strongly encourage our residents to gather when they can. Of course, with COVID, it's hard these days. As far as salary is concerned, here's a list of the current salaries that will be as of July 1st, 2021. Um, and um, one of the things I do want to say is that the cost of living in Syracuse is much less than in other cities. And so definitely the money that you make will go further in Syracuse. You can really get into very nice apartments and also even eat out every once in a while if you want for a pretty reasonable cost. This is a picture of Syracuse itself, and basically what I have here is some highlighted areas, but I do encourage you to watch the video located in our website. Syracuse is a city that is located centrally in upstate New York. It is close to Buffalo and Niagara Falls to the west, Ithaca Gorges and wine country to the south, Lake Ontario and some beaches actually to the north, and New York City is actually to our southeast and about 4 hours away. We also are only 4 hours away from our Adirondack Park, which is a protected park in the United States, in the state of New York. It's known for its fall foliage, viewing forested mountains with hiking trails, crossing the Adirondack high peaks near Lake Placid. Upstate Medical University is located here in sort of the center of the city. Proper near to it is, near to it is Armory Square. That's home of some of Syracuse's better restaurants, at least 2 coffee houses, and dozens of small shops that sell everything from band instruments to used records to women's clothing. It has obviously several bars and nightclubs for a little bit of nightlife. Destiny USA is located right here. And Destiny USA is a 6-story super regional shopping and entertainment complex on the shore of Onondaga Lake. It is the largest shopping mall in the state of New York, and I think it's like 3rd largest in the country. I also indicated Marshall Street, which is close to Upstate Medical University. Marshall Street is the street in the University Hill neighborhood, and it's adjacent to Syracuse University. This area primarily functions as an off-campus commercial area for college students. And then lastly, I would be remiss if I didn't point out our infamous Carrier Dome. It is the largest dome stadium of any college campus and the largest dome stadium in the northeastern United States. It is home to football and basketball and actually has the largest basketball arena in the nation. However, we are soon to lose our dome because it's being replaced with a fixed roof, 2/3 of which will be translucent, and the installation of air conditioning, and I have that pictured right here. So we are undergoing a change as far as that is concerned. So what are the opportunities? And I wanted to spend a little bit of time going through this. There are a series of slides that I've included by our faculty highlighting the areas of interest for our residents. What I'm going to do is I'm going to stop the video now, and then I'm going to create a second video that will outline these slides and then conclude so you can take a break. So I'm going to stop the video at this point, and then we can pick up in a second.